So Professor Eldemire-Shearer is the Executive Director of Mona Aging and Wellness Center at the University of the West Indies. Her academic interests cover both aging and public health, and she is actively engaged in undertaking research in both areas. She contributed to the development of public health programs at Mona, and most recently, the Master of Public Health in Gerontology, Diploma in Gerontology, Diploma in Geriatrics, as well as the PhD in Aging Studies. Professor Shearer also maintains a clinical practice. Now, you will have to ask her how she manages all of that. Now, throughout her academic career, Professor Shearer has remained a strong and passionate advocate for older persons, both locally and internationally. And she has worked with PAHO, WHO, and the United Nations, and has contributed extensively to expert group meetings as well as technical meetings. She is patron of the National Council for Senior Citizens and honorary chairperson of Caribbean Community for Retired Persons. Professor Shearer has been awarded fellow status in the Gerontological Society of America, that's GSA, which is the world's oldest and largest interdisciplinary organization devoted to research, education, and practice in the field of aging. And she also received the Order of Jamaica from the government of Jamaica for her outstanding contribution to older persons. Ladies and gentlemen, please help me to welcome Professor Eldemire-Shearer.
Good still morning, everyone. And thanks to Alzheimer's Jamaica for what seems to have now become an annual event. And we certainly would urge them to continue it because I think our persons living with dementia, if not them, certainly their caregivers, need to believe that people do care and that there is help and they're not alone. Thank you, Professor Leiber, because you have made my life a lot easier with your presentation. So this morning I'm going to look at caring for somebody with dementia during a pandemic. I don't know if it's been more challenging to the persons with dementia or to me who has to look after them. So I start with stress. Do I have a problem here? Because this thing is, I can't see my slide. How do I get rid of this? I only see half my, okay, I can read yours. Okay, no problem. So we know that persons with dementia, living with dementia, function best in an environment that does not change. Thank you. They don't do well being moved around the place or with having the everyday order disrupted. We know that COVID-19 has disrupted the normal. I keep hearing people talk about new normal, but persons living with dementia are not able to accept a new normal. They want what they're used to, what they have been safe in. And I think Professor Leiber referred to that of the safety of the environment. So it's not only disrupted the everyday lives of the persons, but very much so of their families. COVID prevention, COVID disease impact both the persons living with dementia and their families. We know that the cognitive deficits, and Professor Leiber spoke to this already, impact the comprehension and retention of information. And we know it varies from person to person because we have mild, moderate, and severe. It makes complying with protocols challenging, even frightening. I find in my practice that particularly the mask wearing has been very, very challenging for the persons with dementia. It has challenged me as to how best to cope with it. Coping because I guess I'm one of the few that have not stopped seeing patients. I have at least 50% of my colleagues that stopped. But I also don't want to get COVID. So I need to protect myself. I need to protect my office staff. I share a practice with a pediatrician. Therefore, I have persons in my practice who cannot be vaccinated. But I have a wonderful pediatrician, and we have worked out time so that we don't have the two age groups in the office at the same time. Because of course, persons with dementia, like most old people, love children. Children love old people. So in my practice, these children climb all over my patients, and that's okay with my patients. Early on, I realized that masks were going to be particularly challenging. When they brought a patient, one of my regulars, so she was used to the office, she went berserk when she saw everybody in a mask. Now, they had a mask on her, and she wasn't trying to take off hers, but she wanted to know if she was diseased. Why were we scorning her? Because she's not used to this. She went ballistic because, of course, she had not understood. She's used to coming to this office. People are usually friendly to her. Suddenly, everybody is spraying her with sanitizer, taking her temperature, and nobody's coming near to her. And I think it's very important for us in the health professions to understand how frightening it is to persons living with dementia. And then, of course, you have the poor family who is now embarrassed. So I spend more time trying to tell the relative that it's okay, we understand. So now that all of us are vaccinated, we are a little more lenient with the masks than we should be. And I believe most of my patients living with dementia are in fact vaccinated themselves. But the cognitive deficits make it very difficult for both of them. Families and caregivers do try to insist, but then the people, as Professor Leiber spoke to, get very anxious, very frustrated, and can get quite aggressive, especially those with Alzheimer's as opposed to the vascular dementia. So it has been very challenging to maintain this normality, or since we now talk about normal, new normal, let's talk about the normality of the world of the person living with dementia. And yet, it's critical that it be done. So I think families need to recognize that they need to put their own feelings aside, and they need to not be embarrassed and to maintain it as much as they can. Caregiving is often disrupted by the protective actions. I know caregivers who in the earlier phases, last year we were locking down communities as opposed to countries. And then, so caregivers couldn't come out. So all of a sudden you've been living with dementia 5 years, 7 years. You bond to your caregiver. I think we all know that the best way to get somebody living with dementia to do something is go through the person they trust the most. All of a sudden, this trusted person is no longer in their immediate environment. I know many of my patients who were afraid they actually stopped the caregiver from coming because they were afraid of the transport and the taxis. I have one that actually picked up every morning and dropped off every evening, because at that time vaccines weren't available. Now, interestingly enough, this caregiver is an anti-vaxxer. So they have now been given the ultimatum. We're no longer prepared to pick you up because there's no one option. The family correctly has the fear of exposure from the caregiver. I have at least 2 patients that have got COVID from the caregiver. Fortunately, one was fully vaccinated and survived. Again, you wonder what are going through the minds of some of these caregivers. And I think it's very important for families to have a frank discussion. As I have said, persons living with dementia don't like change, and they can be affected by the change of caregivers. And this is not just an employed caregiver, because with the type of community spread that we have seen in Jamaica and the low levels of vaccination, families often get COVID and then they can't visit because they're protective. How do you explain? I mean, most of the people that I am seeing, even the mild persons that are early, don't understand what we're all talking about, because this COVID thing it's not very tangible, and it's a problem. But the caregiver is also affected by stress. We must remember that the caregiver is a human being. Even if the caregiver doesn't want the vaccine, let us respect and remember that the caregiver is also having their own experiences, because we are seeing, I can't remember the number of deaths we have seen, but most caregivers would have lost a family member, certainly would have lost a friend, petrified that they're going to lose their job. And my experience is that most caregivers, the caregiver that survives with a family or lasts with a family, is somebody who has come to love the person they're caring, and the family respects and understands. Thank God, somebody understands and somebody loves them. So the poor caregiver is faced with, what happens if my person gets it? I'm going to lose somebody I love while they're losing others. And then there are all these stories, and the Lord help us with television and all these stories. So we must remember that the caregiver, as much as we want to protect our relative, the caregiver is also stressed, and they need love, they need understanding, and they need a conversation. So we've always focused on caregiver burnout, but I think this is a particularly stressful time for it. And the health services don't understand, but I'm going to come to that. What then of the impact of the disease? COVID has disrupted normal healthcare. The idea of taking somebody to hospital because they are sick is now a foreign concept. None of us want to take anybody to hospital. If you go to University Hospital now, you have to go through 47 people sitting in a driveway on oxygen outside the emergency department because there are simply no beds for them, because the 60-odd beds are taken up. So you have to go through this barrage of COVID to get somebody seen. Health centers are sending out notices saying, send for your prescription. Many of our persons living with dementia have hypertension, have normal prescriptions. There are patients that have not been checked for over a year. They're getting their prescriptions, but nobody has checked blood pressure. Relatives are afraid to take them. The health services don't want to see them. So we have this, again, another double whammy. So I would urge you, to the caregivers, and if you have a question around this, you can put it in the chat and somebody can tell me if I'm to answer it while we're standing here. I think that we need to find a way to at least get their blood pressure and their sugar checked. Diet is also very difficult in this time, because who wants to go to market? Who wants to go to the supermarket? Many of the families who have persons living with dementia are themselves over 60. All of us who are over 60, and I do say us, although I have a waiver, are still under lockdown. We are not supposed to leave our houses. So how do we do these except for essentials? What is essential? Who defines essential? Is a visit to a doctor essential? I think so, but you may not. Do I want to sit in a waiting room with other people? So there are the whole disease, the impact of the disease is just, it's very difficult to document it. We have tried to document it here, and people are afraid. People recognize that the lockdown, the only good thing about all of this is that all of a sudden people think government care about older people. It's interesting. I'm concerned about the loneliness and the social isolation, but the people think government cares. That's why they've locked them down. If the person becomes infected, diagnosis can be very challenging. We know that older people in general do not respond the same way as younger people. Therefore, confusion is quite often the sign of COVID in somebody over 60, particularly over 75, 80. Yet confusion could be COVID, whether or not you know of the exposure, because of the oxygen lack. Which is it? Do I just presume it's something in the dementia? Do I just presume it will wear out, give them something sweet to drink, or do I need to get them checked? Then when you go to the hospital to get it, there are delays in care because you have to go through this whole COVID testing thing before you can get to see a doctor. Who's going to give the history? The person living with dementia, who we know doesn't remember what happened yesterday, much less today. So the persons living with dementia are particularly, their families, because they aren't necessarily oriented to what's going on, it's a stressful time. It is particularly stressful if, suppose they're sick, suppose they really have something wrong with them, and the blood pressure, the heart rate, everything suggests they need medical care. There's the 48-hour period where you have to wait for the COVID test to come back. They're isolated, they're locked in a room. Professor Leiber referred to the restraints. You can't explain to me what's wrong. And I had a patient referred for a medical condition who had to go through this routine of the COVID testing, was locked in a room for 2 days, the COVID room, pending the report. Of course, got boisterous because she had never been separated from her daughter. And it finally, when 2 days and the test come back negative, so she can have her care, she's had a stroke because she has gotten so agitated, and nobody knew she had on a mask. So nobody noticed it. And it's when they give her to her daughter, the daughter says, "Can't you see she's had a stroke?" The lady ends up dying of pneumonia from the stroke, not from COVID. So the disease has really impacted, and we must all understand that, and we must listen to the caregivers and the families. There is the potential worsening of the dementia due to the inflammatory effects of COVID. And in fact, there are at least 3 people who obviously would have been undiagnosed and would have had some memory loss, who have come out severely demented from their stay in ICU. One is in fact the doctor. And you're superimposing on top of the delirium associated with dementia, the delirium of COVID. So we need to recognize and to provide the information, as you are doing, as to what's going on. Clearly, vaccines are the answer. There's no other way for us to control COVID. There's no other way for us to avoid dying from COVID. It's clear the lockdowns don't work. Even Barbados has now had to say they have community spread again. Clearly, everyone in the household, I suppose I should have put here who qualifies, because clearly we can't give it to children who are not yet, needs to be vaccinated. It's the best way to protect our loved ones. And so I congratulate you for your vaccine drive-through tomorrow. And this is something that we'll do not only tomorrow, but we can facilitate once a month for people who need to get to the point. We have a team here. We've been doing children with autism. We've been battered from pillar to post already. We have done several persons with dementia, and the team knows how to speak to them, how to handle them. And we look forward to welcoming any that have been embarrassed. One lady with a daughter with autism said we were her third center. And the way they spoke to her at one of them, she just got in the car. She actually sat outside for 2 hours trying to get the courage to ask if we would vaccinate the daughter. But she knew, she said, don't go in the car. She's going to run from the needle. And we brought her inside and did her. So we can deal with a person living with dementia who's going to run from us. Don't be embarrassed. Do not be afraid. The team here understands dementia, and they will get your person living with dementia vaccinated. Thank you. You have anything in the chat you need me to answer? Okay. Thank you.